Welcome back, Juliana.
Thank you.
So I heard that you had an accident and something is going on with your knee.
Yeah, I was longboarding and I fell. And I fell onto my knees and also kind of sprained my ankle. And I also fell on top of the longboards, like here. Okay. So here also I have pain. And then down my knees and foot.
Okay, so left knee and foot and the left side of your abdomen.
Yes.
Okay. How long ago did this happen?
A week ago.
1 week. Did you hit your head when you fell?
No.
On a scale of 1 to 10, how intense was the pain right after the fall?
Right after was like 5.
Okay.
Right now I would say is a 3 or 4. When I exercise it's worse.
Okay. And the longboard, you said that it hit you right here.
Yeah.
Okay,
I fell onto it.
Was there any penetration of the skin or?
No.
Okay. I'm not able to see a bruise, but it does feel like the area here is very swollen a little bit.
Mm-hmm. And it's very tender when you press it.
Okay, let me just compare with this side. So it's definitely hard here. And a little softer here. So you might have an internal bruising. Okay. Any pain when I press down?
A little bit.
Are you on any new medication?
No.
Did you lose consciousness when you fell?
No.
That's good. Any other symptoms with your eyes, your ears? Oh.
No.
Okay, good.
And I've taken like a muscle relaxant to help with the pain, to sleep.
That's good. And did it help?
Yes.
Did you take anything last night before you came in to see me?
No.
No. Good. So no ibuprofen or Tylenol, nothing for the pain. Good, so I should be able to observe exactly what's going on without interference from any other medication. Good. Any flu-like symptoms?
No.
Okay. Are you able to elevate your leg at all? Okay, that's good.
It hurts a little bit.
So, restricted mobility. Okay. Can you uncross them and cross the other leg over? Okay, now can you go back? Okay, that's good. Confession time. Who else loves smelling like luxury but hates spending a fortune on designer perfumes? This used to be me, but not anymore. Enter Dossier, a brand that is revolutionizing the fragrance game. I've been wearing Dossier fragrances for a while now, every day, and let me just say, my perfume collection has never looked better or smelled better. With Dossier, you can own high-quality scents without spending hundreds of dollars. You can even order up to 9 scents at once, making it easy to find your new signature fragrance. Ambery Saffron, inspired by MFK's Baccarat Rouge 540, which retails for $465. With notes that linger all day, the saffron and orange blossom scents will steal your heart. Dossier only charges $44 right now, a fraction of the cost for the same exact smell. Just look at the quantity, 50 milliliters in each bottle, filled all the way to the top. Magnetic top is just an amazing perfume. I also got the Ambery Vanilla, another favorite of mine. Ambery Vanilla, inspired by YSL's Black Opium, which costs $130. This is the ultimate confidence boost smell. Why not get it from Dossier for only $26? The exact same smell, a fraction of the price. You must check out the Gourmand Orange Blossom scent. It's divine. Gourmand Orange Blossom perfume inspired by Lancome's La Vie est Belle, which retails for $118. This is a true head-turning feminine fragrance that starts as a floral trio of jasmine, orange blossom, and orris, blended with a fizzy touch of blackcurrant and hazelnut. You will make an impression while wearing this perfume. It comes beautifully packaged, so it makes for the perfect gift. Click on the link in the description down below and use code lunaluxx10 for 10% off. You will get premium products at incredibly affordable prices. Let me go ahead and put my gloves on. And I'll begin by doing a visual inspection of your abdomen and your knee from this position. And how long ago did you get the tattoo?
Probably 10 years.
Yeah, it looks like it healed just perfectly. Okay. So let me just go ahead and take a look first. Okay, I'm feeling for any inflammation first. And I am able to see a couple of scars here, but they look pretty old, right?
Mm-hmm.
Okay. Let's see. Any pain here?
A little bit.
Okay. So let me go ahead and check for any crepitus. And we're gonna go up one time and then down. Okay. Down. Okay, good. I'm not able to hear any clicking sounds or anything that might indicate an actual tear of the meniscus. Not seeing any bruising or any rashes or irritation on the skin. Okay, I'm gonna go ahead and tap very lightly on the kneecap right here and around it, and I want you to tell me if you feel pain.
Yes.
Okay, right here?
Mm-hmm. Yes.
Okay. On a scale of 1 to 10, how intense was that?
4.
A 4. How about right here?
Yes.
And here?
No, goes right here. Yes.
Okay, let me go ahead and take a look at your abdomen too. Any pain there?
No. 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 Yes.
No. Okay. How about here?
Yes.
Okay, you can come back up now. Yeah, I understand. So you have pain right here, and then right under the meniscus, more so on the median zone than the lateral one. Okay, let me just quickly listen to your heart and lungs to make sure that I'm not missing anything obvious. Okay, just go ahead and breathe normally. I'm able to hear S1 and S2, not hearing any extra sounds. Okay, take a deep breath in and out. Good, I'm just assessing your lungs now. Good, you can breathe normally. Okay, I'm going to check your aortic pulse. Good. And I'm going to check for any bruits around your carotid artery. Good. And I'm going to take your pulse manually. Good. I'm going to check your brachial pulse and radial. Okay, very well. Can you squeeze my hand? Good. Can you bend forward? Good, and then bend back. Perfect. Can you go like this? Okay. Does this hurt right here?
A little bit.
Okay. You can lower your arm. Okay. So lungs and heart exam was a pass. No bruits were heard. Abdomen is swollen and slightly distended on the lower left side. Okay. No obvious breakage of the meniscus. Okay. Can you keep your eyes closed and let me know when you stop feeling a touch?
Stops.
Okay.
Stops. Stops. Stops.
Okay. And
Stopped.
good.
Stopped. 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 Stopped.
Good. Okay. Checking the proportions. 34. 30. Okay. That is symmetric. You feel a little warm to the touch. Have you noticed a fever in the last couple of days?
No.
No. Okay, let me go ahead and check your temperature. 98.9. That's good. And may I please have your index finger? Okay, let's leave that for a second. So no fever and upper body dermatomes are intact. Abdominal dermatomes are intact. 99% oxygenation and 80 beats per minute. That is within normal parameters. Okay, let's go ahead and lay down and I'll take a closer look at your abdomen and your knee. Okay. Okay, let's do a couple of range of motion so that I can understand exactly the extent of the damage here. Can you elevate this leg? Okay, now lower it. Now can you do it on your own? Okay. And how about the left arm? Okay. And any pain right there?
No.
How about here?
A little bit.
Okay. Let me go ahead and focus on the abdomen first. Is it okay if I elevate your top and lower your pants?
Yes.
Okay. gonna go ahead and palpate the area. Checking for symmetry around your abdominal cavity. And checking for any masses. Okay, can you elevate this foot a little bit? And yes, you can, like that, and just rest it there. Good. So that the muscles are not tightened. Okay, good. I'm not able to feel anything abnormal. I'm gonna go ahead and clean the area. Okay, I'm going to check the dermatomes on your abdomen. I caused a vibration. Go ahead and tell me when you stop feeling it.
Stop.
Okay, good.
Stop. 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 Stop.
Good. Go ahead and tell me if you feel this on the left side of your abdomen or the right one.
Left. Right. Left. 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 Right.
Okay, good. And now I'm going to touch you with 1 or 2 prongs. Go ahead and say 1 or 2.
2. 1. 2. 1. 1. 2.
Good. Now I'm going to touch you with something sharp or dull.
Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull.
up, it's going to be something wet or cold. Wet. Cold. Cold. Wet. Cold. 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 Wet. 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 Okay. You have a slight elevation of the skin on the left side. The elasticity and the pinch test. Okay. Checking the right foot for any signs of edema. As well as the left. The left kneecap is definitely more swollen. Comparing it to the right one. A little bit of an inflammation right here. And checking the tibia bone. Can you tell me if you feel a sensation on your right foot or the left one?
Left.
Good.
Right.
Good. Now can you tell me when you stop feeling it?
Stopped.
Good.
Stopped. Stopped.
Good.
Stopped.
Okay. Can you push with your pads into my hand? Perfect. I'm gonna do an inspection of your toes. No signs of clubbing or pinning on the right foot. Gonna check the left one. These toes are a little more reddish than these ones. Yeah, I think you have a slight inflammation going on with your toes. Okay. Going to feel the plantar region. Okay. Right foot is normal. Any pain there?
No.
Okay. Can you bring your big toe toward your head? Perfect. Now try again. Perfect. And now point towards me. Okay, reduce mobility on this one. Okay. Can you tell me if you feel me touching you on your right foot or your left?
Left.
Okay.
Right.
Okay. Now I want you to flip face down so I can take a look at your calves and your ankles. I'm going to palpate your calves. No signs of any edema. And measure your ankles. Okay. They are very symmetric, so I'm not feeling any swellness or seeing any asymmetry with your calves. Okay, can you tell me if this is sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Good. No nodules behind the skin. And no abnormal reactions on the bottom plantar region. Okay, am I touching you on your left or right foot?
Left.
Good.
Right. Left. Right. Right. Left.
Good. Okay. Can you curl your toes around my fingers? Okay. Let's try from this position. Perfect. And now squeeze as hard as you can. Good. And now let's try the right foot as well. Perfect. Okay. Okay. I'm going to do the Babinski test. Good. Perfect. So now positive findings. You can go ahead and stand up and we can discuss the result. Okay, Juliana, so I did a very thorough investigation. The good news is that there's nothing neurologically wrong with you. Most likely you just bruised your kneecap and your foot, and the paddle board that kind of pierced you right here created a bruise internally in the abdominal cavity, but that should subside within the next couple of days. So
Okay.
if you don't start feeling any better, then come back and see me.
Okay, thank you so much.
You're welcome. Welcome back, Matt. Good to see you.
Good to see you too, Dr. Luna.
So we're here for a head-to-toe assessment for you today. When is the last time that you had such a procedure done?
About 8 months ago.
8 months ago. Okay. And may I please have your first name and then date of birth to make sure that I have the right medical chart?
MAD, June 2nd, 89.
All right. Mad. So anything bothering you with your health? Anything you would want me to focus on in particular during today's session?
Yeah, I'm having a lot of pain. It's radiating towards the bottom right and left side.
Okay.
And also I've been experiencing some very itchy scalp areas. And I feel like it's kind of traveling from left to right.
Okay, the back of the head here.
Yeah.
Okay, let me just feel. Okay. Do you experience those sensations right now?
Yeah.
Okay, so lower back. And when did the lower back symptoms start?
About 3 months ago.
3 months ago. And the scalp?
Could have been the same time, but it was after the back pain.
Okay. On a scale of 1 to 10, how intense is your back pain?
4.
Okay. Does it wake you up at night?
Definitely.
Okay. Do you feel like you're able to go through your daily activities just fine, or does it keep you from just being functional during the day?
I can function, but honestly, it's a very low pain that it starts to be intolerable.
Okay. Have you changed your shampoo or conditioner in the last 3 months?
Not lately.
Okay. Are you on any medication right now on a daily basis?
No, just daily vitamins.
Daily vitamins. And those are just over-the-counter vitamins?
Correct.
Okay. Any blurred vision or double vision, especially when you're experiencing the back pain here?
No.
Okay, so not accompanied by any other pain. Do you feel like your eyes are getting itchy or dry when you experience the scalp sensations?
No.
No. Not accompanied by any other symptoms. Okay. Any flu-like symptoms in the last 2 weeks?
No.
Any major surgeries? I haven't seen you in a couple of years, so.
I had a wisdom teeth removed
Okay.
on the right side. Otherwise, no surgeries.
Wisdom tooth removal. All right, Matt. So what I'm going to do today is perform a head-to-toe assessment, and I'll focus on your cranial nerves as well as your dermatomes. So dermatomes are areas of the skin that are innervated by the same spinal nerve. So I'll check those out in your face, your scalp, and your chest.
Okay.
And focus on your back as well.
Okay.
Okay. And do you feel those sensations on your scalp right now?
Yes.
Okay. On a scale of 1 to 10, with 10 being the most intense, what is their intensity right now?
4.
Alright, so let me just go ahead and feel your head as well as the back of the spine here and check for any lumps, bumps, or any abnormal sensations to my touch. Checking C1 and C2 at the top of your spine. And your neck. Any pain when I'm pressing down on your C1 and C2?
Yeah.
Okay. I'm not feeling any lumps or bumps, so no hidden masses. Okay. Pressing down on your mastoid bone process. Any pain there?
On the right side and left.
Okay. Okay, checking your neck for any masses as well or indentations. Good. Cervical and occipital lymph nodes are not enlarged. And preauricular, posterior auricular, submandibular, submental. Okay, good. All right, I'm gonna just listen to your heart first, as well as your lungs. Have you noticed any shortness of breath or any heart palpitations that give you trouble?
No.
Good. Okay. So go ahead and just breathe normally. Just gonna take a little listen to your heart. Good. So I'm hearing all normal sounds, no murmurs, no extra sounds. Good. Now take a deep breath in. I'm going to listen to your lungs. And out. Good. Deep breath in. And out. Good. Deep breath in. And out. Good. Perfect. So lungs in the front sound normal. And heart checks out as well. So I'm just going to take a couple of notes here. No wheezing, no crackling, no signs of any pneumonia. And then your heart, S1 and S2 could be hurt. Okay. Also going to check your temperature. This is going to go over your forehead and behind your ear. Good. 98.3, so definitely you don't have a fever. And let's check your oxygenation as well. So this is your index finger into my device here. You can just rest it on your leg. And I'm going to check your brachial pulse. 6, 7, 8, 10. Good. And you're choroided as well. 3. Good. So rhythm is normal, not hyperdynamic or thready or weak. 99% oxygenation, 85 beats per minute, so good rhythm to your heart. Okay. I'm also going to check your reflexes since you're in the right position for that. Go ahead and close your eyes and open your mouth slightly. I'm just going to tap lightly on it. Good. Then tap on your shoulders. Good. Good. And I'm going to tap on the top of your head to check for any abnormal neurological responses. Good. To the sides of the head. Good. Good. Any pain when I was doing that? No. All right. Go ahead and relax your arm. Good. Can you uncross your legs, please? Good. 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 Perfect. All right. Very good. Next up, I'm just going to observe your skin and just focus on your arms. So So if you can just keep your eyes closed and relax. I'm looking for any neurological signs that could manifest in the form of redness, irritation on the upper part of your limbs here. Okay, let's check your face too. Look up for me. Just going to take a peek at the base of the eyes. Good, it's clear eyes, white, conjunctivitis, pink and moist. Okay, you can close your eyes now. Good. Okay, just going to look in the inner part of your arm. Okay, good. Then over here as well. Okay, good. So no abnormal skin symptoms. All right, I'm gonna check your eyes next. If you can just open them for me. Just gonna do a couple of tests. So looking right here and try to keep your head steady. I'm going to check for your pupil response. Okay, good. Good. So pupils are round and reactive to light. I'm going to check for the direct and consensual response. Keep looking right here. That's direct and consensual. Good. Then over here too. Direct. Good. Perfect. All right. Now I want you to look into the distance. I'm just going to observe your eyes from the side and check for any bulging or any jaundice. Good, perfect. All right. When is the last time that you had an eye exam done, Matt?
About 5 years ago.
5 years ago. Okay. Well, let's check your vision really quickly. I want you to cover one eye, and I'm going to mirror you. And I want you to tell me when you see my fingers escape your field of vision.
No.
Good. And now when my fingers enter your field of vision.
No.
Good. Now let's do the same. Cover the other eye. Okay, fingers out of the field of vision.
No.
Good. Fingers into the field of vision. Good, perfect. All right. And now I want you to continue looking into my eyes, and I'm going to elevate my finger right here, and I want you to try to touch it with any one of your fingers while looking at me. Good, perfect. And now over here, perfect. Perfect. Good. And now touch right here and touch your nose. Good. It's a good balance. All right. Next up, I'm going to use my ophthalmoscopy right here and take a peek in the back of your eye and check your optic nerve and optic disc. Okay, we're gonna need this in a second for the ears, so I'm gonna put it right there. Let me turn it on, and you can just look into the distance. I'm just going to first make sure that I have a clear view of your eyes. Then I adjust my device here. Oh, it's a little bit blurry. Hold on. Oh, that's perfect. Okay. So I'm going to come really close with my device. So go ahead and just Continue looking into the distance. I'm going to just take a peek right there. Okay. Cone of illumination is present. No redness. Optic disc is intact. I'm seeing a good ratio, so this eye is perfect. I'm going to do the same in the other one. Okay, so let's take a peek into this other eye as well. Okay, beautiful brown eyes. Perfect. Okay, I'm going to come really close. Okay, let me just pull a little down. Good. Look up for me. Look down. Forward. Okay, good. Okay, so let me just make a couple of notes. Eyes look good. This clear eyes white. No discharge from your conjunctiva. The optic disc is intact. Conal flight was present. And I saw a good ratio in the optic disc in both of your eyes. Okay. So what I'm going to have you next is put on the medical gown, and I want you to lay down, face up, and we'll continue the exam. Okay, Matt, I'm going to check your ears next. And I'm just going to palpate the front of the ears. And at the top. Okay, good. I'm going to turn on my otoscopy. Just take a peek inside. If you can just tilt your head towards your right, perfect. Okay. Good. I can see all the bony landmarks. And tympanic membrane is pearly gray, not inflamed. Good. Right, and if you can move your head towards your left, I'm gonna take a look in here as well. No inflammation or discharge, just a little bit of wax buildup, the normal amount, and physiologically normal tympanic membrane, which is pearly gray. Good. All right, you can come back looking towards your right. Okay. I'm gonna go ahead and check your sinuses. Just going to palpate. The top here is a little bit inflamed. Do you usually suffer from allergies?
No.
Okay. Now I'm feeling some puffiness here. Any pain there?
No.
There? Okay, might just be allergies. Okay, checking the adenoid and sphenoid sinuses here. Good. And the maxillary sinuses. Any pain there?
No.
Good. Okay. I'm going to do some light tapping on your face to see if there are any positive neurological reactions. Good. Okay. No reactions noted. Okay, I'm going to take a look at your scalp next, starting with the top of your hairline here. And then I'll work my way back towards your neck, nape, and spine. Alright, so I'm going to focus on the top of your head here. Just going to inspect your skin. I'm not seeing any redness. Just a little bit of dandruff, but in the normal amount. Okay. Can you count how many taps you feel?
2. 1. 1. 3. 4. 6. 1.
Okay, good. Now I'm going to apply some pressure, and I want you to say yes when you feel it.
Yes. 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 Yes.
Okay, good. And now I want you to tell me if you feel that pressure towards the right or the left of your hairline. And this is the hairline right here. Okay, so let's begin.
Right. Left. Right. Left. Right. 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 Left. Right.
Okay, good. Now I have here two different devices. One is cold and one is warm. Tell me if you feel warm or cold.
Cold. Warm. Warm. Warm.
Okay, good. And this is dull and this is sharp. Do you feel the difference?
Yes.
Okay, go ahead and say sharp or dull.
Sharp. Sharp.
Okay. Okay, good. Let's take another sample of your hairline. Maybe towards the side here. More towards the center. Center right. Okay. Is this sharp or dull?
Sharp.
Okay.
Sharp.
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 Okay. And am I touching you with 2 pressure points or just 1?
2. 2. 2. 2. 2. 2.
Okay, very good. Okay. Alright, let's go ahead and flip face down so I can take a look at your back. Alright, Matt, I'm gonna take a look at your hairline here next. Just checking the strength of your hair strands and looking for any breakages, any patches of hair loss. Good. Not seeing any alopecia signs and no excess dandruff on the side of the hair. Okay, is this sharp or dull?
Dull. Dull.
Okay.
Sharp. Dull. Dull. Dull.
Okay, good. Now I'm going to touch you with 2 different textures. One of them is wet and the other one is dry. Go ahead and say wet or dry.
Wet. Dry. Wet. Dry.
Okay, good. Now let's take a look at the back of the spine too here. Okay. Is it okay if I unbutton your gown?
Yes.
Okay. So I'm first going to visually inspect your back. Looking at the short shoulder blades, the scapula. I'm not seeing any blue or gray colors, no redness. Checking the nape area as well. Okay. So no visual signs of any abnormalities. I'm going to go ahead and palpate the back. But first I'm going to check for any skin indentations. That I may have missed. Okay, I have one big mole here. One color, well-defined borders. Is that painful? No. Okay. Okay. Good. So not noting any indentations. I'm going to go ahead and palpate your spine. Check for any lumps, bumps, or deviations of the alignment. Okay. So C1 to C5 do not present any indentations. T1, T2 are okay. Going down to L1, L2. Good. All right, and now let's check the back of the spine here where you mentioned that you feel the sharp shooting pain. Okay. So I'm checking your L12 and 11, and I'm feeling some bumps over here and a slight deviation of the spine. So you may have the beginning of scoliosis. Okay. Let's check your dermatomes in the back of the spine here. Can you tell me if this is sharp or dull?
Dull.
Okay.
Dull. Sharp. Dull. Sharp. Dull.
Okay.
Dull. Sharp. Sharp. Sharp.
Okay.
Dull.
All right. Next up, I'm going to cause a vibration, and I'm going to test for the changes in pressure, and I want you to tell me when you stop feeling the vibration.
No.
Okay.
No. No.
Good.
No.
Good. Okay, now I want you to tell me if you feel the vibration on your left shoulder blade or your right shoulder blade.
Left.
Good.
Right.
Good.
Left.
Good.
Right.
Good. Okay, and now I want you to tell me if you feel this sensation continuously all the way to the top of your spine.
Yes.
Okay, good. And how about this one?
Yes.
Good. And this one?
Yes.
Good. And this?
Yes.
All right. And this? Okay, good. Now I'm going to apply localized pressure, and I want you to count how many times you feel me applying that pressure. How many
2.
was that? 2. Good. How about this?
3. 2.
Good.
2. 2. 1. Did I feel that?
So there is a loss of sensitivity in the lower back here. Okay, did you feel that?
Yes.
And how about this? How many times am I poking you here?
2.
2 times, okay. So L12, L11 area is where the numbness and the sensitivity loss is localized. Okay. Is this cold or warm?
Cold.
Okay. And this?
Cold.
This?
Cold.
Okay. I'm gonna go ahead and listen to your lungs as well. So go ahead and take a deep breath in and out. Deep breath in. Out. Good. Okay, you can just breathe normally. Good. Good. And checking the base of your lungs. Okay. Good. So no crackling or wheezing in the base of the lungs here. Next up, I'm going to check the capacity of your lungs. So I'm going to place my hand right at the base of your thoracic cavity here. So take a deep breath in for me. And blow in, yes. And then release. Okay, another deep breath in and release. Okay, good. All right. I'm going to button up your gown next, and I'm going to take a look at your legs and your feet. All right, Matt. Next up, I'm going to take a look at your legs. And first I'm going to check the popliteal pulse. Okay, good. And check for any signs of edema in your legs by pressing down. You do have a little bit of swollen legs. Do you usually get any water retention? Do you suffer
haven't
from?
noticed that.
You haven't noticed that? Yeah, they're a little bit swollen, but I'm not seeing signs of edema. Just feels like you're retaining a little bit more water than usual. Do you have any pain in your feet right now?
No.
Okay. Your feet are a little bit cold. Okay, pressing down on your plantar region. Any pain there?
No.
Okay, good. Okay. So definitely cold and getting warmer towards your knees. Okay. I'm gonna check your pedal pulses. 2+, synchronized. Okay. And I'm going to check in between your toes. Inspect the area. Good, the nails look healthy. No signs of any clubbing or pitting. Any pain there when I'm tapping on your nails?
No.
Good. Okay. All right, so looking healthy at the first glance. I'm going to press into your pads there, the bottom of your feet. Can you push into me? Good, perfect. Now I'm going to attempt to spread your feet apart, so don't let me do that. Resist, good. And I'm going to press 4 toes towards me. I want you to push your big toe towards you. Good, perfect. And we're going to do the same on your left leg. So bring your toes, big toe towards your head. Perfect, good. And now I'm going to press down on 4 of your toes. Bring both of your big toes towards your head. Okay, can you do it a bit more? Perfect, good. Okay. Let's check your sensitivity. I'm going to slide a slightly cold object on your legs here, and I want you to tell me if you feel anything that's bothering you, any pain or any sensation that's unpleasant.
No.
Okay, good. 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 And is this sensation continuous?
Yes.
Okay, all the way up to here?
No.
Okay. All right, patient does not note any pain or jolting sensations. Good. All right. I'm going to do a little tapping, so this is going to be slightly more intense sensation. I'm looking for any abnormal neurological responses. Okay, good. Hue is good. Tibia bones are intact, and the metatarsals are normal as well. Okay, good. Now I want you to flip face down so I can take a look at the back of your feet and legs. Okay. So let's take a look at your calf muscles here too and check for any edema. Okay, I'm seeing the same temperature gradient that I noticed earlier where your feet are very cold, but your legs and moving up towards your limbs is getting warmer. Okay, before I do anything else, let's check the Babinski reflex. I want you to just leave your foot loose. Good. Foot loose. Perfect. So no positive Babinski. I'm going to touch you with 2 textures. One of them is cold and the other one is dry. So I want you to say wet and cold or dry.
Dry. Dry. Dry. Dry.
Okay, interesting. So no differentiation between wet and cold and dry. So that's definitely a loss of sensitivity there. Okay, can you tell me if this is sharp or dull?
Dull.
Okay.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
So plantar region is definitely not attuned to the sharp sensation. Okay, can you wiggle the toes for me? Okay, so you can wiggle them. Good. Okay, you can sit up now. We can continue the exam. And so you definitely mixed up some of the sharp or dull sensations, as well as you couldn't differentiate between wet and dry on your legs. So there's definitely some nerve damage going on with you. The back as well, you had some loss of sensitivity around the L12, L11 vertebrae. So I'm gonna go ahead and check your dermatomes a little bit more in depth and focus on your face, your chest, and your legs here towards your thighs and your knees. So let me go ahead and ask you to close your eyes, please. Do you feel this sensation?
Yes.
Okay, so that's dull. And do you feel this?
Yes.
That's sharp. Okay, so let's go ahead and try to see if we feel sharp or dull.
Sharp.
Okay, good.
Dull.
Okay, good.
Sharp.
Good.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Okay. And is this cold and wet or dry?
Cold. Dry. Cold. Dry. Dry. Cold. 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 Dry. Dry. Cold. 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 Cold.
Okay, let's go ahead and open our hands.
Cold. Dry. Dry. Cold. Dry. Cold. 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 Dry. Dry. Cold. Cold. Dry. Cold. Cold. Cold.
Okay, Matt. So there's definitely some sensation, sensory losses that you're experiencing. So I'm gonna go ahead and order a complete blood panel for you, as well as an MRI and a CT scan. And let's review those results, and then we can think of a treatment plan for you.
Okay.
All right, do you have any questions for me today?
No.
All right, great seeing you, and I'd like you to be back in about 2 weeks so we can discuss those results. Okay, so today I'm going to do cupping therapy on your back in order to relax the muscles, improve circulation, and promote relaxation. You mentioned that you have some back pain, Alessandra. Is it localized towards your lower back more so, or upper back?
On my lower back.
Lower back. Okay. So I'm also going to be doing essential oil massage therapy and make sure that we relax all of the muscles, scapulas, and that we improve blood flow, the oxygenation in your skin. Okay. Going to begin by putting on surgical gloves. And have you ever had cupping therapy done before, Alessandra?
Yeah.
This will be the first time. Okay. I'm going to begin by prepping the area first. Do a gentle exfoliation. That will make sure that we remove the top dead layer of the skin. And is it okay if I lower your skirt a little bit?
Yeah.
first going to inspect your back to make sure that there are no lesions or micro lesions that I should avoid when applying the cupping. I'm not seeing anything macroscopic. I'm also going to use a dermatoscope. Looking for micro lesions now. So your skin is not penetrated in any way. There are no lesions, nothing that would interact negatively with the treatment that I'm going to perform on you. Okay. Let's go ahead and begin. This one did not stick. I'm gonna redo it. There you go. This one needs to be reactivated. Good. I'm going to apply a little oil. At the location of the suction. And magnesium oil to relax the muscles. We'll let that sit in. Spread it around. This magnesium treatment is going to help promote the ease of tension. And after the cupping therapy, it will be absorbed by the skin very fast. that pressure pushing the oil a little more. Next up, I'm going to do a light massage. up, we're going to do a series of tests. I like to understand if the sensitivity in your back has been enhanced by the treatment that we just applied. So I'm going to touch you on either your left side or your right side of your back, and I want you to say left or right.
Left. Right. Left. Right. Left. 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 Right. Right.
Good. Okay. And now I'm going to apply some slight pressure on your spine, and I want you to count how many times I am pinching you.
Once. Twice. 3 times. 3. 1, 2. 1. 2.
4. Okay. I'm going to tap you, and I want you to count how many times you feel me tapping you.
3. 1, 2, 3. 3.
Good.
1. 1.
Good.
3.
Good. Alright, next up I'm going to finish the session with some skin pulling.
2 days ago, I was doing yoga,
Okay.
and I lost balance in my feet when I was doing the warrior pose, and I fell and I heard a crack.
Oh, okay. So sorry to hear that.
Yeah, it's like my middle back hurt, and then it's been affecting my ability to sleep comfortably. So because of that, my lower and a little bit my upper back has been hurting as well.
Oh. Do you have any pain right now?
Yeah, it's pretty bad. It's mostly in the middle, but also like kind of throughout.
Okay. So middle and lower back, and the pain radiates. And when did this happen?
2 days ago.
2 days ago. And you were working out and you heard a crack. Were you able to just lay down and take a rest right after?
Yeah, I had to lay down for a good bit because I was in a lot of pain.
Okay. On a scale of 1 to 10, how intense was the pain?
Like 8.5, 9.
And how about right now? How much pain are you in right now?
Like a 6.
Any blurred vision or double vision or hearing problems?
I did that night, but I haven't really noticed it since then. I had blurred vision.
Any flu-like symptoms in the last couple of days?
No, I had a flu a couple weeks ago, but I'm fine now.
That resolved itself? Were you on any medication for that?
Yes, I don't remember what I was prescribed, but I did take something. I just went to urgent care.
Okay, probably an antiviral. And are you able to bend forward?
Oh no.
No,
It
that
hurts really
hurts.
bad, yeah.
How about back? If you can.
Then it hurts after a little bit, yeah.
So forward and backwards mobility is restricted. Can you twist your body?
I'd rather not. It hurts when I do it.
Can you bring this arm over on this side of the body? Cross body movement?
It hurts my shoulder blade up the top here.
Can you lift your arms?
Actually, my left shoulder blade hurts when I do that, but my right is okay.
Yeah, your left shoulder is a little more elevated than the right one.
I think it's because of the way I've been sleeping, though.
And have you had any headaches?
Yeah, for sure. I've been having a migraine since then. It also gets in the way of my sleep.
Do you feel that the pain radiates from the back upwards towards your spine, your head?
I feel like it's kind of separate pain. It doesn't really radiate toward my head. I think it's just a migraine.
So there's a discontinuation of pain here.
Yeah.
Okay.
Separate.
So the head problem must be separate from the back. Have you noticed anything else you'd want me to know?
Oh, actually, when I fell, I mainly hit my back, but I hit my head a little bit as well. So maybe that's why I've been having the migraines.
And where did you hit your head?
On the back. I didn't hit it too hard, but maybe that's why.
The back. Does it hurt when I touch it?
Not there. It's a little higher. Yeah, there it hurts.
Got it.
It's not unbearable, but it does hurt a bit.
Yeah, I can feel indentation on the left side.
Yep, that's where it hit a bit more.
Okay. Did you lose consciousness when that happened? Okay, good. No loss of consciousness. Were you able to stand up and walk afterwards?
Yeah, I could. Yeah, I was in a lot of pain, but I was able to walk.
So you could keep your balance. You weren't swiveling.
Well, I was a little bit, but that went away the same night. But I had to lay down for 20 or so minutes before I could get up.
Okay, that's good that you did that. Okay, so I'm gonna do a back exam and focus on the spine as well.
Okay.
And the head. And just the overall, the back of the cranial area. And let's see how we can help you out today with the treatment, maybe a light massage, and see if we can relieve a little bit of the back pain that you're experiencing.
Thank you so much.
Okay, so I see that I have here your medical chart, and you're not allergic to anything. Good. And I see that I have your blood results from about 6 months ago. So we don't need to redo those. Okay, and I have seen you before for some skin disorders, numbness. How is that progressing?
Oh, that went a lot better. And the amoxicillin helped with my ear infection as well.
Okay, that's wonderful to hear. Perfect. Okay, so I'm gonna set the chart aside. And I'll just sanitize hands. And start off by taking your vital signs. And I'm just gonna feel your body temperature and check for symmetry. Good. I'm gonna check your temperature over the forehead and behind the ear. 98.3, so you do not have a fever. And let's check your levels of oxygenation as well. May I please have your index finger? And let that rest over there for a few minutes. I'm gonna check your pulse over on your artery here. So go ahead and just breathe normally. Good. And I'm gonna check your brachial pulse as well. And pay attention to your respiration rate. %99% oxygenation, 65 beats per minute, so very relaxed heart, normal pulse, about 14 to 16 breaths per minute, so that's normal. Go ahead and take a note of that. So good vital signs. 14 to 16 breaths per minute. And oxygenation is normal. Brachial and carotid pulses were normal. And let's see your heart and lungs as well. Have you noticed being out of breath or any heart palpitation?
For sure. It was actually kind of hard for me to breathe right after that happened.
And how long did that last?
Like, it got better after an hour and a half-ish, 2 hours.
Okay.
But it's still lasting.
And when you're walking up a flight of stairs and down?
Definitely out of breath more easily.
Okay. So let's go ahead and check your heart then. Just go ahead and breathe normally. And is it okay if I slide the stethoscope?
Of course.
Inside the shirt here. Listening for S1 and S2. No S3 and no S4. Good rhythm. Go ahead and take a deep breath in and out. Okay, deep breath in and out. Good. Checking for any fluid coming from your carotid artery. Any obstructions or anything concerning would be indicated by presence of a fluid. Oh, good. Okay, vital signs check out. I'm gonna go ahead and just look at you physically in normal light condition just to make sure I'm not missing any facial signs or anything on your body that would need further investigation. And then I'm gonna take a look at your back.
Okay, sounds good. Thank you.
Just looking at the color of your skin.
Oh, Jesus.
Just looking at the color of your skin. And I'm gonna check for any edema. So I'm gonna just press lightly on your hands and your arms. Do you feel any pain here?
No, it's okay. There I do a little bit closer to my shoulder. Yeah, my left shoulder and neck hurt a little bit.
Right there.
Mm-hmm.
Gonna do a gentle tapping. Let me know if you feel pain.
Yeah, I do. A little bit less there. I feel it there too. Oh, I think it's the worst.
Okay. So the upper tendon on your shoulder here is impacted. I'm going to check the integrity of the clavicle here. Any pain there?
Yeah, they're the same. Less so there. It's okay there.
That feels fine. That's okay also. There's pretty bad.
You do have an indentation here. Gonna take a look at it in a second. Okay. So go ahead and put on the medical gown and let's take a look at your back.
Sounds good. Thank you.
And I'm gonna do an inspection and try to localize the source of the pain for you.
Okay.
And assess which muscles are most impacted. And then we're gonna do a massage on those muscles to relax them.
Sounds good. Thank you.
Okay, is it okay if I unbutton your
Yeah,
gown?
sure.
And I could also tell that your left shoulder here was very much affected. So I'm gonna go ahead and just begin by palpating. And is it okay if I bring your hair up?
Sure.
Using a clip, just so that I can see the neck area. There we go. Let's see if that's gonna stay. Definitely some inflammation over on the left shoulder here. I'm checking the scapula. Any pain there?
Yeah. Yeah, there's more there. Yeah, there's a lot of pain there.
How about here?
Less so there, but it's still present. Same thing there. It's less there also.
Okay, so the whole left scapula is impacted. Any pain here?
No, it's fine there. More to the middle, there's more pain. Yeah, there's some good pain there. Yeah, I think that's where most of it is.
Okay, so starting from the right scapula here, which seems to be fine. Is that okay? Okay, so all the way to the left here. Okay, I'm gonna check your spine next and check the vertebrae to make sure that there are no nodules in between them. Okay, and the spine is straight. Okay, good. I am seeing a red dot right here. Seems to be a mole or a recent skin lesion or an abnormal growth from within the skin. I'm gonna take a sample and we'll send this to the lab. It may be completely unrelated to the workout accident that you had, but we need to make sure. Okay. Okay, so I took a sample and I'm gonna send this to the lab. I'm also going to just take a look with the dermoscope. And make a note of the size, which is about 1/4 of an inch. And I'm also going to look at it under UV light. That seems normal, but the irregular borders and the red color makes me want to double check on that. Okay, so let's continue with the back exam. I'm going to palpate towards the lower back. Checking for any masses, any elevations of the skin. And also checking for symmetry. I'm not able to feel anything out of the ordinary. Checking the tension in the muscles. Okay, so that's normal. Over on this side, I am feeling a lot of tension as measured by the resistivity in the skin. And left side definitely feels to be innervated. With a lot of tension in the mid left back. Okay. So I can definitely localize the source of the pain as being part of the deltoid muscle here. Any pain when I do this?
Yeah.
Okay. So we need to relieve the mid to upper back here. And I will be applying some acupressure and gentle massage. So I'm going to ask you to just lay down on the table and hopefully we're going to relieve some of this tension.
Okay, thank you.
Okay. I'm going to first take a couple of measurements for you. Cross your waist 30, 47, 46 and a half. Cross your back 29, the mid back 30. Okay. Did you feel that?
Mm-hmm.
And how about this?
Mm-hmm.
Okay. Can you say now when you stop feeling a touch?
Okay. Now.
Good.
Now. 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 Oh, now.
Good. Just checking for the continuity of sensation here.
Now. Now.
Okay, there doesn't seem to be any areas that are lacking sensation.
Now. Now.
Okay, good. And is this sharp or dull?
Dull. 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 Sharp. Sharp. Dull. Sharp. Dull.
Going to do light acupressure around around the area that I have felt the tension in. And this should relieve the muscle.
My left shoulder blade already feels better and more relaxed.
That's wonderful. There are specific points, trigger points, in the mid to upper back, around the margins of the scapula, that can be triggered to just relax the overall muscle. I'm mostly trying to follow the margins of the scapula here. Sensory stimulation will further help relieve the muscles. therapy will also help ease some of that tension, especially when applied to the trigger point that were just stimulated. I'm also going to apply magnesium that will get absorbed through the skin and further relax. So you're going to hear a fizzling sound now. And skin pinching will make sure that the oil is absorbed. And delivered straight to the muscle tissue. Okay, Anastasia, this concludes the exam for today. I was able to really narrow down on the muscle that's really tensing up for you in the back here, and I applied some acupressure, massage, so hopefully that will help in the next few days.
Yeah, thank you. I feel better already.
Wonderful. I don't think there's anything else physiologically wrong, but if the pain persists, then come back to see me, and then we can reassess.
Okay, sounds good. Thank you so much.
Okay, you're most welcome. Do you have any questions for me today?
No, not really.
So I'm gonna make a note here of everything that we did. And I do recommend that you take an oil that has magnesium and then you continue to reapply. And you can find that at your just local drugstore, pharmacy. But other than that, yeah, you should be all good within the next few days. Let me know if you're not.
Sounds good. Thank you.
Great seeing you today.
You too. Thank you.
I've been having some tingling sensations in my scalp, in my back, the back of my neck, and they radiate towards my chest as well. And I've been hiking recently, and I think I pulled a muscle in my back because my back also hurts a lot.
Wow, so there's quite a few things going on here.
Yes, I'm a little bit concerned about the tingling sensations because they wake me up at night and they're quite unpleasant.
I'm so sorry to hear about that. Do you currently have those sensations?
A little bit on my back, yes. And I feel not just a tingly sensation, but also a numbness. So it goes tingly, then numb, tingly, then numb.
Wow, so we'll definitely do some sensational tests. And can you just show me exactly where you feel them?
Yes. Right here. And here.
Okay, just want to have a quick feel.
Yes.
You are quite warm to touch.
Yeah, I don't know. Maybe coming down with the fever as well. I've been just having hot flashes ever since I woke up.
Okay, well, let's definitely check your vital signs to start off with. Have you been near anybody who is sick?
No, nobody in the household has had any symptoms of sickness or anything.
Awesome. Okay,
No.
that's great. And then did you fall for all these things to start popping up?
When I was hiking, I think I tripped one time, but I didn't fall. I didn't hurt anything, but I did use all of my muscles all at once, and yeah, maybe that's why I pulled my back.
You might have definitely pulled your back, so we can definitely do an assessment there. And we can try to relax the muscles as well with just a little bit of cupping therapy.
So I heard that skin pulling can help with relaxation. Is that something you can help me with today?
Yes, definitely. We'll go ahead and do that for sure.
Great.
What I would like to do though is make sure that your vitals are clear, just so that I don't have anything to worry about while we're doing the examination on you.
Great.
And just a few other questions. Do you have any allergies?
I'm allergic to grass. Every time I touch grass, I break out in a rash and I get itchy all over. And yeah, it's been hard trying to stay away from grass, but I've managed it. No picnics.
Okay.
No barefoot walking in the forest, unfortunately.
Well, that is unfortunate. No camping?
No camping. No, I don't like camping.
I don't love it either. All right. Let's go ahead and start with your vitals. I'm going to begin by listening to your heart, looking for a strong heartbeat, and also looking to see if there's any crackling in the lungs. So I'll just have you breathe normal for me. No heart palpitations. Good. I'll have you breathe in deep. And exhale. Any pain?
No.
Breathe in deep. And exhale. Any pain?
No.
Just going to have a listen of your chest. Take a deep breath in. And exhale. Very good. Just going to go ahead and listen with my bell here. Yes, your heartbeat is strong. I'm not hearing S3 or 4, so S1 and 2 are there, which is great. I'm going to go ahead and just put my gloves on. Did you have anything to eat today?
I did have breakfast, yes.
Good. You're not feeling dizzy or nauseous at all?
No.
Perfect. Let's go ahead and check your temperature. Just want to make sure that you're not running a fever. Okay, you are 98.8 Fahrenheit, which is in the green. So there's no current fever. 99.1 would be fever, so we're close, but not quite there. Let's check your oxygenation and your heartbeat per minute. We'll let that sit there for just a second. Okay. Looks like your oxygenation is 97 and your beats per minute is 82, which is normal. What I'm going to do is I'm just going to have a feel of your face and a feel of your head to make sure that there's no bumps or scratches or anything.
Okay.
So I'm just going to have a feel here. Is this where you feel the numbness?
Yes. The back of my neck and the nape area going down my back.
Okay. Just gonna have a feel of the face. You are quite warm. I'm gonna feel the ears here. And then your tonsils. Have you ever had tonsillitis?
No.
And let me just have a feel of your sinuses. How are they feeling? Are they swollen at all?
All clear.
And just having a feel of the lymph nodes here. And then the preauricular and postauricular. There's no enlargements. Any pain over here?
No.
Just having a feel of the arms here. And feeling the temperature all the way to the hands. Just going to check your capillary response. Good. Can you wiggle your fingers? Very good. Check your capillary response here. Perfect. I'm going to go ahead and check your skin, just a very quick skin analysis. We do have, it looks like normal to dry skin, is that correct?
Yeah, I'm usually a combination.
Okay, I'm not noting any abscesses or anything particular we should be worried about. Your scalp is healthy. Your hair is thick and full. We'll go ahead and do a scalp exam later. I want to focus on your cranial nerves. So if you could, shrug your shoulders for me. Don't let me push them down. Very good. And relax. Widen your eyes. Okay, now close them. Good. Open them back up. Raise your eyebrows. And don't let me push them down. Very good. I'm going to try to turn your head. Don't let me. And the other way. And I'm going to try to push back. Don't let me. And pull forward. Don't let me. All right. I'm going to take a look at your eye movement. Okay, so I'll just have you follow the light for me. Good. Now I'll be doing just a few sensational tests. I'm going to start off by palpating. Just say yes when you feel it.
Yes. 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 Yes.
Just going to palpate the clavicle. Okay. I'm going to go ahead and check your reflexes. I'll have you relax into my hand here all the way. Very good. I'm going to put a cold sensation such as this on your face.
I can feel it, yes.
I want you to just say where you feel it, okay?
Forehead. My chin. My chest. Right cheek. Left cheek. Left hand. Right arm.
Lovely. You can keep your eyes closed and we'll do sharp or dull. This is sharp and this is dull.
Dull. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Very good.
That felt good.
Wonderful. What we're going to do is we're going to move on to your back.
Okay.
We'll do lots of cupping and we'll try to just have you feel better before you leave here today.
Sounds great.
Are you comfortable?
Yes.
Lovely. I'm just going to be putting your hair up.
Okay.
Now you're all right with me opening the gown?
Yes.
I'm going to start off by examining your back with my light. Just a thorough skin inspection. Looking for a reaction. I do see a few moles here. Have you had them checked?
Yes, I had to check from the melanoma.
Okay, your scalp looks healthy. Hair distribution on the bottom is full and thick. Doesn't look like there's any hair loss going on there so far. I'm going to go ahead and measure from the top of the spine down to the lumbar. 20 inches. Shoulder to shoulder. 19. Good. I'm going to use my other device here to measure the fat symmetry. About half an inch. Same on both sides. Half as well. The neck. Okay. Just going to measure the neck here. Point 4. 8.2. Same on that side. About the same. 25. 22. Just going to measure the circumference of the head. 24. 15. Perfect. Going to do some skin cracking, okay? This should help really increase blood flow. shoulders are quite tense. I think the cupping will really help with that after the skin cracking. Just going to add a little bit of cold therapy to help relieve those achy muscles. Since your skin is quite red, I want to just help cool things down a little bit. How's that feel?
Great. Very relaxing. I love it.
Okay, I'm going to go ahead and do some sharp or dull. This is dull, and this is sharp.
Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay, now we're going to do dull or cold.
Cold. Cold. Dull. Dull. Cold. Dull. Cold. 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 Dull.
Lovely. Going to spray you. I just want you to say yes when you feel it.
Yes. 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 Yes.
Very good. I'm going to move on by adding some oil to your back so we can go ahead and do the cupping and gua sha therapy. Is that okay?
Yes.
Have you ever had cupping before?
Yes. Oh, that's good.
tension there.
You really do. Okay, I'm not going to do that one because it's going to make a weird sound. This should be very comfortable for you.
That feels good, yeah.
Great.
I love it.
Does it feel okay?
Yes, that's great.
Perfect. Okay, now I'm going to add 4 different styles. 5 actually. We'll really try to focus on some tension release. Just let those sit for a little bit. Are they feeling okay?
Mm-hmm.
You are going to have a little bit of redness. Is that okay?
Don't keep them too long.
Okay. Try to do one by your neck area. That was an extensive therapy session there, so you will see a little bit of redness on your back. Now I'm just going to be using the gua sha tool here. Is this okay?
Yes.
And is this okay?
Yes.
You are getting red from the tool, which indicates some stagnant blood flow, stagnant cells. And just let me know if you're in any pain at all, okay?
Okay.
Really working on those tight muscles here. Does it feel okay?
Yeah, feels great.
Are you still doing okay?
Yeah, all good.
And is this okay?
Yeah.
Now that we've done a lot of work on you, I am going to add some kinesiology tape. This will just help keep everything in place. I want you to take it easy, okay? Take it easy for the rest of the day. Do you have any plans?
No, I can just relax in bed.
Good plan. All right, let's focus on your scalp. Are you comfortable?
Yes.
I'm going to start by combing your hair. Just having a general look at the scalp. Noting just a tiny bit of flakiness, not much. Skin on the scalp is healthy, well nourished. Can you feel this?
Yes.
Does this feel cold?
Yes.
Let me know if you feel sharp or cold.
Sharp. Cold. Sharp. Cold.
How are you feeling?
Wonderful. The cupping and the skin pulling really helped loosen up my back muscles. I feel relaxed.
Well, you do look a lot more relaxed.
Oh,
You look like you
yes.
could go take a nap.
I will for sure.
Well, I hope you have a lovely rest of your day and let me know if you need anything else.
Thank you so much. Good to see you again, Juliana.
Thank you. Good to see you too.
So today we have an appointment for an annual medical assessment. And when is the last time that you had such a procedure done?
Probably 10 months ago.
Okay. Is there anything in particular that you'd like to address in today's visit?
Yeah, I'm having some pain on my right side, and it wakes me up at night, and it's just on the right side. I usually take ibuprofen for the pain.
Okay. On your chest, your arm.
Yeah, like here, even my face a little bit, and here, my thighs. It's always on the right side.
Okay. Right. Side pain. And when did this pain begin for you, Juliana?
Probably 2 months ago and has been increasing.
Okay.
When I'm relaxed, usually it's worse. When I'm exercising or doing stuff, I don't feel it. But when I'm sleeping or just relaxing in front of TV, I can feel it.
Okay. On a scale of 1 to 10, how intense is the pain?
Right now, 2. But at night, when I'm really relaxed, when I'm sleeping, sometimes it can go up to 7.
Okay. 7 out of 10 at night. Does it wake you up at night?
Yes.
Okay. And where do you feel it most intense? Is it on your upper body or lower body?
It varies depending on the day.
Okay. Can you describe the pain a little? Is it sharp or dull?
When it's more intense, it's sharp, and also sometimes I have a tinglish sensation and numbness a little bit on my hand or my thighs.
Okay, numbness on your hand. Okay. I understand. Okay. Are you on any new medication?
No.
And the last medical assessment that you had done 10 months ago, was there anything abnormal that was found?
No.
Okay. So no positive findings there. Are you allergic to any medication?
No.
Have you had any major surgeries done or any procedures I should be aware?
No.
Okay. Have you tried any ointment or lotion or anything on the skin?
Yeah, I've tried hydrating my skin or some lotion, but it didn't really do much.
Have you noticed any rashes on your skin?
No.
Okay. So let me go ahead and put my medical gloves on. And I will do a head-to-toe assessment today, focusing on the right side of your body. And we'll get to the root cause of what's been ailing you. Are you in any pain right now?
A little bit.
Okay, let me go ahead and just observe your physical appearance first. Okay. I'm just looking at the skin for any external signs, any redness, rashes, any colors that are abnormal. Okay. Let me look on the inside of your arm. And for comparison, okay, I'm not noting any redness or visible signs of edema. Face is symmetric, no discoloration. Okay. Let's go ahead and take your vitals. And I'll start off by listening to your heart and lungs. Have you felt any heart palpitations or any shortness of breath?
No.
Okay. So go ahead and just breathe normally. Gonna listen to your heart. And take a deep breath in and out. Good. Deep breath in and out. Deep breath in. Good, you can breathe normally now. Okay. And I'm also going to check the base of the lungs. Good. Let's go ahead and take your blood pressure as well. Right artery and right here. And you can just lower your arm and relax it. Okay. Okay, blood pressure is a little elevated. 140/69. Have you had any flu-like symptoms in the last 2 weeks or so?
A little bit.
Okay. Any runny nose, any headaches?
No,
Just feeling
just a little
fatigued.
fatigue. Yeah.
Okay. Let's check your levels of oxygenation. Okay, you can leave that there for a second. I'm going to check your temperature. 98.2, so you do not have a fever. And oxygenation is 99% and 85 beats per minute, so that is good. Just going to make a note of that blood pressure, which was a little elevated, 140/69. Normal temperature and oxygenation, lungs and heart exam, no positive findings. I'm not hearing any hissing sounds or any bronchitis or anything troubling with your lungs, so that's a good news. Okay. I'm going to go ahead and just palpate the right part of your body and see if I can feel any masses, any nodules, any lumps. Okay, just go ahead and relax. Okay. And I'll start with your head. Okay, checking the choroidal pulse, which is normal. And palpating your lymph node, the preauricular lymph node, posterior auricular, mastoid bone process behind the ear, no enlargement noted, submandibular submental lymph node, cervical, supraclavicular, axillary, and pectoral. Okay. No enlargement noted. Gonna go ahead and assess the right clavicle here. And shoulder. Do you feel this equally on both sides of your arms?
Yes.
Okay. And do you feel this equally on both sides of your arms as well?
Yes.
Good. I'm not seeing any reactions of the skin to the light scraping. Do you feel this equally on both sides of your neck? That's 1 and 2.
Yes.
Good. 1 and 2.
Yes.
Okay. And on your forehead, that's 2 and 1.
Yes.
And your cheeks, that's 2.
Yes.
Okay, very well. I'm gonna go ahead and take a couple of measurements and check for symmetry and overall proportions. 22. 12. 28. 27. 33. And can you elevate your hand just like this for me? There you go. 72. and exactly 72. Okay, good. You can lower your arms now. Okay, I'm gonna go ahead and check your eyes. Can you look right here? Okay, that's 1 and 2. Good. And can you look up from him? I'm gonna take a peek at the conjunctiva and sclera. Okay, perfect. So good pupil response there. Size of the pupil in normal eye condition is about 3 millimeters. Good. And I'm also going to check the optic nerve and optic disc. Okay. Go ahead and look into the distance for me. Perfect. Good. Good. Okay. Go ahead and close one eye for me. Cover one eye and look at my nose and count how many fingers I'm holding up. 2. Okay, good. 1. 1. Perfect. Now cover the other eye. Look right here and count. 2. Okay, good. 5. 1. Good. Perfect. So peripheral vision and optic nerve and disc are intact. No physiological damage to your eyes. And good pupil response. Right, I'm gonna go ahead and check out your hearing and your ears next. Have you noticed any ringing in your ears? Anything upsetting you?
No.
Okay. So let's go ahead and just take a quick peek inside. And see if there are any signs of any infection. Can you look over to your left for me? A little bit of wax buildup, but in the normal amount, and tympanic membrane is intact. Good. So no signs of any infection. I was able to visualize the tympanic membrane. I want you to close your eyes and we're going to do a hearing test. And I want you to tell me if you hear a sound with your left or your right ear. Okay.
Left. Right. Left. Left. Right.
Good. And now I want you to tell me if you hear the sound moving towards you or away from you.
Okay. Towards me. Away from me. Towards me.
Good. Okay, so ears are okay. Tympanic membrane intact. I was able to visualize all the bony landmarks and no signs of any infection. Okay, so there's definitely nothing viral or bacterial going on. So I'm going to go ahead and focus on the skin. And we're going to do a series of tests so that I can assess you from a neurological point of view.
Okay.
Okay, so we're going to do a sharp or dull test. And may I have your palm? This is what sharp feels like. It's not going to pierce the skin. And this is dull.
Okay.
So go ahead and keep your eyes closed and say sharp or dull.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Dull.
Okay. And now I want you to tell me if you feel me touching on your right side or left side of the body.
Okay. Left. Right. 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 Left. Right. Left. Left.
Okay. Now one object is going to be wet and the other one is going to be dry.
Okay. Wet. Dry. Wet. Dry. Wet. Dry. Dry. Wet. Wet. Dry. Dry. Wet. Dry. Dry. Wet.
Okay. Now I'm going to use my device to cause a vibration and place it on various bony prominences of your body. And I want you to tell me when you stop feeling that vibration.
Okay. Stopped.
Good.
Stopped.
Good.
Stopped. Stopped.
Good.
Stopped. Stopped.
Wonderful. Okay. Now I'm going to spray a very slight, very subtle mist of water on your body, and I want you to tell me if you feel it on your left side or your right side.
Okay. Left.
Good.
Right. Right. Left. Right. Left. Right. Right. Right.
Good.
Left.
Wonderful. Okay. And I'm also going to apply dull pressure on your body, and I want you to use just your right hand and try to point to where I'm touching you.
Okay.
Good. 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 Wonderful. I'm going to attempt to create a scraping sensation on the right side of your body to observe how the skin reacts to that. I'm looking for any excess vascularization or innervation. Okay, so skin reacts normally. Okay, and finally, I'm going to touch you with this object that has two different prongs, and I want you to try to determine if I'm touching you with one or both.
Both. One.
Good.
Both.
Good.
Both. One.
Good.
Both.
Good.
Both. One. Both. One.
Okay, let's try on the inner side of your arm as well.
One.
Good.
Both. 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 One.
Perfect. And finally, I'm going to tap the bony prominences to observe any abnormal neurological reactions. I'll start at the top of your head right here. Okay, good. Checking the eye reflexes. Perfect. Good. Now, can you just open your mouth slightly? Good. Good. Perfect. You can close it. And can you leave your weight into my arm? Very good. Good. And same over here. Just leave your weight into my arm. Good. Let's try the knee. Okay. I'm also going to go ahead and just check your scalp really quickly in this position and observe your responses. As the scalp is stimulated, sometimes we can have more intense neurological responses. So that's what I'm checking for. Juliana, I can lay down now and I can take a closer look at your tummy and your feet. Okay. Okay, Juliana, is it okay if I lower your skirt a little bit and raise your top? Okay. I'm gonna go ahead and check the abdominal area, focusing on the right side here, where you mentioned that you experienced pain and the tingling sensations. I'm going to begin by just doing a visual inspection. Skin is normal. Inspecting the belly button next. How long have you had this ring for?
17 years.
17 years, okay. That looks wonderful. No signs of any infection or redness. I'm gonna go ahead and listen to your abdominal sounds. Go ahead and just breathe normally. I'm hearing activity in all 4 quadrants. Good. I'm gonna go ahead and palpate. Feel for any lumps, bumps, masses. I'm gonna do a light palpation first. And a deeper one. Okay. I'm going to search for the point of maximum impulse on the mid-clavicular line on the between the 5th and the 6th intercostal membranes here. That's where I can actually feel the pulse right there. Good, that's normal. Okay, I'm going to do a pinching test. Good. Skin reacts normally. And the light percussion. Sounds are a little more hollow and dull on your left side than the right side. Yeah, definitely. No abnormal reactions of your skin. Okay, Go ahead and tell me if you feel me touching you with one or two objects.
One. One. Two. One. One. Two. One. One.
Let's go ahead and check your feet and your legs. Okay, I'm gonna go ahead and check your legs. And I'm just palpating, feeling for any signs of edema. Feeling the popliteal pulse by your knees. Normal. And the pedal pulse 2+, synchronized. Okay. I'm gonna go ahead and do a visual inspection of your skin. Gonna check in between your toes. No signs of nail clubbing or pitting. Good. No rashes or edema in between the toes. Gonna check your capillary refills. 2 seconds. Good. Can you try to curl your toes around my fingers? Perfect. And now can you just wiggle your toes? Perfect. Can you do it any faster? Good. It's a normal level of mobility there. Can you try to push with your pads into my arms here? Good strength. And can you attempt to bring your toes towards your head? Good. I'm gonna go ahead and do a light palpation of the plantar region. I'm gonna go ahead and check your saphenous and sural nerves in the plantar region of your leg. Can you feel this?
Mm-hmm.
And this?
Yes.
Good. And this?
Yes. Yes. Yes.
Good. And can you tell me if you feel a mist of air on your left foot or your right foot?
Right,
Okay, good.
left, right, left.
Good. I'm going to do the Babinski test. Good. Good. Can you tell me if I'm touching you on your left foot or your right?
Right, left, right, left, right.
And now can you say now when you stop feeling the touch?
Stopped,
Good.
stopped, stopped, stopped.
Good. So dermatomes on your legs and your feet are okay. Now I want you to sit back up so I can take a look at your back and your spine. Taking a look at the scalp for any redness, dandruff, or any signs of folliculitis. Not noting anything abnormal with the scalp and no excess breakages. Good. I'm gonna go ahead and just inspect your back and check the curvature of the spine. There is a slight curvature at the bottom. Lumbar spine. Have you ever been diagnosed with scoliosis?
No.
Just very slight. Just need to keep an eye on it. Okay. palpating your cervical spine. And going down to thoracic and lumbar. Good. Not feeling any nodules or masses in between the vertebrae. Okay. Gonna go ahead and listen to your lungs. Just breathe normally. Okay. No bruit or any adventitious sounds. I'm gonna go ahead and do a light percussion. And a slight tapping on your spinal cord to check for any abnormal neurological responses. Okay. Very good. Checking the skin. Good. Okay, Juliana, this completes the assessment for today. I did a very thorough investigation of your body, head to toe. I focused on the right side and I'm not able to see anything abnormal. But the pain that you mentioned is considerable, so I would want us to monitor that. And I would like you to take an MRI and go into a more in-depth investigation of the right side of your body.
Okay, thank you so much for seeing me today.
Great, I'll see you in 2 weeks after you have the MRI taken.
Okay, thank you.
You're welcome. Welcome back, Rita.
Hi.
My name is Dr. Luna and I'll be doing your medical checkup today. May I please verify your date of birth?
My date of birth is August 20th, 2002.
All right. And when was your last checkup?
It was almost a year ago.
Were there any abnormal findings during that procedure?
Yeah. I was diagnosed with arrhythmia.
Okay.
And I've been also feeling palpitations.
Heart palpitations?
Yeah.
Okay. How long have you had them for?
I've had them for a few months now.
All right. Are you on any medication for that?
I take a beta blocker.
Anything else? Any other medication?
No.
Okay. In addition to the heart palpitations, do you feel any dizziness or any headaches?
I have been feeling a lot of dizziness.
Okay. And how often do you feel that?
Every other day.
How bad is it on a scale of 1 to 10?
I would say 8.
Okay, so that means you have to stop what you're doing and lay down.
Yeah.
Okay, so it's probably preventing you from going about your day to day. Any shortness of breath?
No.
Okay. Have you noticed the heart palpitations and the dizziness getting better or worse over time?
I think it's kind of stayed the same over time.
Okay. Any chest pain or discomfort?
A little bit.
Okay, can you show me where you feel that?
I'd say like over here.
Right there? Okay. Does it radiate anywhere else in your body or? Okay, so it stays localized.
Yeah.
Got it. Have you had any fainting, any episodes of syncope?
No.
So no losing consciousness during the dizziness?
No.
Okay. And how's your energy level overall? Do you feel tired often?
I do actually feel tired often.
Okay. And do you feel like you get enough sleep at night?
I actually do get enough sleep.
How many hours would you say you usually sleep for?
Say 7 to 8.
That should be enough to go about your day without feeling tired.
Yeah.
Any troubles with your ears and hearing?
No.
All right, Rita, let's go ahead and begin your annual checkup, and I'll focus on the cardiovascular system today, as well as your back, your legs, and your feet. Okay, I'm gonna set this aside and put on the medical gloves. And I'll start off by taking your vital signs. Are you feeling dizzy right now?
I think I'm okay right now.
And how about the chest pain? Do you feel it?
It's pretty normal right now.
That's good. That means we're gonna get a pretty good baseline for you. Okay. So I'm going to take your temperature first. This is going to go over your forehead and behind the ear. 98.2. So you do not have a fever. I'm gonna check your heart rate as well as your oxygenation. The index finger right there. Okay. You can just keep this here. And I'm just going to feel your pulse on your neck. Is it okay if I touch you on your neck? Okay, good. That feels normal. So carotid is normal. I'm also going to check your pulse brachially. Good. And your heart rate is 100 and 99% oxygenation, so that is all good. I'm just going to make a note of that. So temperature was normal, heart rate and oxygenation within normal parameters. I'm gonna go ahead and listen to your heart and lungs. Okay. ahead and relax. And this may be a little cold, so I apologize about that. Okay, just breathe normally. Not able to hear any murmurs. Good. Take a deep breath in. I'm going to assess your lungs. And out. Okay, deep breath in. And out. You can breathe normally now. So heart and lungs sound okay. Good. So I'm just going to observe you physically first. Go ahead and just relax. I'm looking for any abnormalities that are physically present that would indicate anything that we should further investigate. So looking at your neck and the chest. And on the inside of your arm. Okay, that's normal. No obvious abnormalities of the skin. I'm gonna go ahead and palpate your arms first, but before that I'd like to assess if you have tremors. So go ahead and elevate your arms like that. Good. And let me just observe them. You can close your eyes and I want to see if you're able to keep them at the same level. 1, 2, 3, 4, 5. Good. No tremor is present. I'm going to go ahead and palpate and check for any signs of edema or any pain that is more than usual. Can you move your head left to right? Perfect, and then back. Okay, and forward. And then back. Perfect. Okay, I'm gonna go ahead and check your blood pressure. Have you had this done before? Okay, is this arm okay? Yeah. Wonderful. So let's go ahead and match this over the artery. ahead and just relax. Right, very well. You can just slide this. So blood pressure was a little elevated. Have you noticed before that your blood pressure is elevated? 130/85. Or is this the first time you were told?
This is the first time.
Okay. Right. You may want to consider maybe cutting down a little bit of the salt in your diet. That should help lower the blood pressure.
Okay.
All right. Next up, I'm going to check your reflexes. So I like to close your eyes, and I'm just going to tap on some bony prominences of your body and check the neurological response. I'm going to start at the top of the head here. Okay, good. Good eye reflex. Good. Can you open your mouth a little bit? Slightly. Perfect. Good. Okay, relax your arm. Good. Checking for the tendon. Okay. Good. Wonderful. And then can just leave all the weight into my arm. Okay, good. And same here. Good. Good. Okay. Next up, I'm going to palpate your head and your neck and feel for any inflammation of the lymph nodes, any masses that are under the skin. Is that okay? Okay, checking your lymph nodes. Tonsillar, submandibular, and submental. No elevation inflammations are noted. Moving down to the cervical lymph node. Occipital. Good. Deep cervical in the back. And then supraclavicular. Go ahead and shrug for me. Yep, shrug up. Perfect. And then lower your shoulders. Good. Okay. And then pectoral and axillary. Good. So I'm not noting any inflammations of the lymph nodes. Okay, go ahead and look into the distance for me. I'm going to check your eyes. Good. And now look at my nose. Good. Perfect. And now look into the distance again. Good. I'm going to pull down on your eyelid. I want you to try to look up. Okay. Good. And now look down. Good. Perfect. When did the watery eyes start?
Maybe a month ago, I think.
Okay. I'm not seeing any physiological abnormalities. So we may just treat the watery eyes with some over-the-counter drops.
Okay.
I'm going to assess your optic nerve to be really sure there's nothing internally wrong. Go ahead and look into the distance. Wonderful. So optic disc and optic nerve are intact. I wasn't able to see anything wrong with the retina and well-defined margins. So eye exam checks out. I'm gonna go ahead and take a look at your scalp next. Have you noticed any itchiness, any redness, any pain when you're brushing your hair or showering? Wonderful. You have very thick hair. I'm not noting any abnormal breakages. And I'm able to visualize your scalp. No redness. Can you move your head towards your left? And then towards your right. Okay. Good. Okay, next up I'm going to take a couple of measurements and note the symmetry of your limbs. May you please elevate your arms just like that. Okay, we're at 72. 72 and a quarter. Good. You can lower your arms now. 18. Good. 36. 17. Good. I'm going to assess the dermatomes of your skin, and I'm going to touch you with this spatula on your left or right arm. I want you to keep the eyes closed and tell me if you feel me touching you on your left or right side of the body. Good. Good. I'm also going to touch you on your face. Good. Okay. Do you feel this equally on both sides of the forehead? Yes. And about the same? About the same? Yeah. About the same?
Yes.
Okay. Next up, I'm going to touch you with something either sharp or dull. This isn't very sharp, so it won't penetrate the skin, but you will feel a very different sensation.
Okay.
Keep your eyes closed and say sharp or dull.
Dull. Sharp. 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 Dull. Dull. Sharp.
Very well. Next up, I'm going to cause a vibration and I'm going to place it at various positions on your body, and I want you to try to localize that.
Shoulder.
Okay.
Right shoulder.
Good. Wonderful. And now I want you to tell me when you stop feeling the sensation. You don't feel it? Let's try it again. Do you feel the vibration?
Yes.
Did it stop?
Yes.
Good. So just say now when you stop feeling it.
Now.
Good.
Now.
Good. This is wet and this is dry and soft. So I want you to say wet or soft.
Okay. Wet. Soft. Wet. Wet. Soft. Soft. Wet. 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 Soft. Wet. Soft. Wet.
Good. I'm also going to focus on your ears. And you said you've not noticed anything abnormal with your ears. Okay. Any discharge or ringing, none of that. I'm gonna just feel around them. Checking the mastoid bone process. And applying some pressure on the front temporal lobes. Good. Does this hurt? And this?
No.
Wonderful. Go ahead and tilt your head towards your left. Going to take a quick peek inside. With my otoscope. No discharge tympanic membrane has well-defined borders. I'm able to visualize the bony landmarks and just a little bit of wax buildup within normal parameters. Your head towards your right. Visualizing the ear auricle. Gonna take a peek inside. Ear canal is normal, unclogged, no discharge, no redness. and normal tympanic membrane, no wax buildup. Ear exam, scalp and hair normal. Dermatomes and skin, neck and chest, no positive findings. Let's go ahead and check your nose and mouth. Have you noticed any discharge from your nose, any dryness of the mouth?
No.
Okay, wonderful. I'm just gonna take a peek inside. No obstructions noted. Go ahead and take a deep breath in through your nose and out. Okay. And do that again. Good. Nostrils are not obstructed. Go ahead and open your mouth and say ah. Okay, good. Teeth are intact and no redness in the back of the throat. Mouth and nose. A pass. I want you to squeeze my hands now. Good. And I'm going to attempt to push you backwards. Don't let me do that. Good. Okay. Let's also do a hearing test. Keep your eyes closed and try to count how many clicks you hear. Good. Wonderful. And now I'm going to make a sound either by your left ear or by your right ear. Go ahead and say left or right. Good, that was a trick question. Good. Okay. Let's go ahead and lay down and I'll take a look at your back and your feet and your legs. I'm gonna go ahead and inspect your back first. I'm going to feel for any masses underneath the skin. Good. And now I'm going to palpate your spine. The scapula. And I'm going to percuss. And tap around your spine gently. Good. No abnormal neurological reactions. I'm going to cause a vibration again. Place it on your skin, and I want you to tell me when you stop feeling it. Good. Do you feel it? No. It stopped. Good. So I'm going to assess your feet and your legs next. Is it okay if I remove your socks?
Yeah.
And can I elevate your sleeves, the jean sleeves?
Yeah.
Exposing the knee and the tibia. Your feet are cold. Is that normal for you?
Yeah.
Gonna need a bigger light. Sorry. So looking at the color of the skin and the nails, no clubbing or pitting is noted. going to feel the pedal pulse first. Good. And I'm going to cross compare, synchronized, and the popliteal pulse. Good. Palpating for any signs of edema. Good. Good. Checking in between the toes. And can you attempt to bring the toes towards your head? Good. Now I'm going to attempt to spread your legs. Don't let me do that. Resist. Good. I'm going to attempt to bring your feet together. Don't let me do that. Resist. Good. Now can you push into my palms with the pads of your feet? Perfect. And try to push with the heels as well. Good. Alright. Plantar region looks normal. I'm going to go ahead and do the Babinski test. Okay, no positive findings for Babinski. I'm going to go ahead and tap on your legs, tibia bone, metatarsal bones. No abnormal reactions. Palpating the plantar region for any obvious pain. Good. And now push with your toes into my arms. Good. Go ahead and tell me if you feel me touching you on your left foot or your right. Right. Left. Right. Left. Right. Left. Good. Go ahead and scoot up a little bit. Checking the patella in your knees. And the fibula in the back. And let's check the reflexes as well. If you can just, there you go. And relax the foot. Good. And let's arc the leg. Good. Now I'm going to touch with something that will be a continuous touch. Go ahead and say when you don't feel the sensation anymore. I'm also going to listen to your pedal pulse. Okay, heart down. So did a very thorough investigation. Head, neck, cardiovascular system, ears, eyes, dermatomes. So the neurological connections between your brain and the skin. Sensations, legs and feet. So you mentioned that you are on a beta blocker. Yes. That's probably the propranolol. Is that correct?
Yes.
That's usually prescribed for arrhythmia. And do you know how many milligrams you are per day with that?
I'm not sure.
Okay. So I'm gonna write down the smallest dosage and let's confirm at the next checkup.
Okay.
And how many times a day are you taking that medication?
Once a day.
Once a day. Good. Okay. So that completes the assessment.
Okay.
Thank you for coming in today, and let's reassess where you are with your heart in about 6 months.
Okay. Thank you.